Welcome back to California Life. I'm here in the beautiful offices of Dr. Busso here in Beverly Hills, and joining me is Dr. Busso. Thank you so much for having us here.
Thank you, Heather, and thank you for having me, and good morning.
Good morning, and I have been telling everyone that I know about what you call the Busso Way with doing Botox, where it's truly painless, and I'm surprised how many people don't know about this.
Yeah, it's a simple way. Everything that we do that can produce some discomfort or some bruising, because people want to get a procedure and go on with their lives. So use a massager, basically creates vibration, and that reduces discomfort significantly. And also, before any injections is performed, we map the area with a laser so we can see the blood flow, so we can avoid certain blood vessels, and then we don't have bruising, so people are ready to go.
It truly, it seems like such a simple thing that, you know, you're almost tricking it. You get a little pleasure with a little pain and you don't feel the pain. And one thing that I've always said to even just my friends is I think it's so important that you do go to an actual dermatologist, cosmetic surgeon, even for something like Botox or fillers. And why do you think that's important?
Well, training is important, and being able to know options. If you only train in Botox, let's say, but you do not know all the other options there are to offer in a cosmetic menu, so then you might not be offering the best option for that particular effect that the patient is looking for. So it's not, if you only have a hammer, everything looks like a nail. If you only know how to do Botox, you only do Botox, but lasers, surgeries, threads, procedures, peelings. So it's a broad, so for that you need to go to the proper education training so you can offer your patients the best options.
And I am a little bit of a baby about fillers. I told you that when we met the first time, but I am so impressed that you were on the groundbreaking floor of fillers, and you really did put me at ease. And tell me a little bit about your history.
Well, I was always, the way I fell into the cosmetic field was basically because my patients, which I had an HIV-based practice, once the disease became a chronic infection and my patients that were young and deformed from the treatments had some major cosmetic requirements, then I started to study the cosmetics and how to reverse those effects from treatments. And I realized there was a scientific field just as complex as any other field, and it was as interesting. So then I was able to dive into it. And obviously, the first thing was fillers, because patients had major fat loss on their faces. I started to become involved with different clinical trials. Did a clinical trial for Bellafill at the beginning of 2000, then the clinical trial for Radius, and I was able to improve the techniques and the form we were using those products, and it got challenging and fun at the same time.
And tell me a little bit about, I know with the mask, we're all looking at the eyes and we all suffer from dark circles. What is your little secret with helping with dark circles and filler?
One little secret that most people do not know is that dark circles are actually not dark from pigment. It's just that the under eye becomes hollow. So it's a shadow, not pigmentation issue. So with fillers, we can reverse that effect. And definitely it's a life-changing effect. So that technique is a complex technique. I've been perfecting that technique for the past 2 decades. And I feel extremely comfortable in performing. And it's so simple. And it makes such a positive effect on the person. You see how the person builds up confidence immediately after they see the dark circles disappear. And the results hold for a long time. So it's really, really life-changing.
And so is it filler that you're using in with the dark circles?
Yes, for dark circles, definitely. Now the trend that we're experiencing is we're developing better products, better techniques, better understanding. So today it's more about the patient, it's more of me and less of fillers. Mm-hmm. So we use fillers only in areas that there's a true deficiency of volume. But if we want to improve cheeks or other areas of the face, we are repositioning fat. So it's more about the patient than about the fillers these days. So, the field is evolving.
And do you do that also with the Busso Lift, so it's a combination.
Right, that was one of the biggest puzzles. Seeing that we can reposition fat pads on the face, seeing that we had threads that conceptually were supposed to do that, but we were not achieving those results. So that was the puzzle. And I decided to devote myself to try to solve that puzzle. And I think we did that through the Busso Lift, developing threads that can really attach to fat, and then we can lift it to the position that we want. So we don't add more volume to that face. We don't change that face. We just reposition structures to where they used to be. Because a little secret is that gravity is one of the main reasons why our face changes. So change over time means aging. And it's one of the areas that if we don't offer surgery, there's not much more you can do. So now we open a whole new field of a non-invasively being able to reposition patients' fat or structures that have descended through gravity to restore the original anatomy. And it's all about the original anatomy. We don't want to change people's faces. We want to empower them and go back to what they used to be so they can see themselves as opposed to someone else.
When somebody comes here to see you, what's so nice is they get to see you, and meet you right away. Do you recommend they bring like a picture when they were younger, or can you just look at them and say, this is what I recommend?
It's a combination. Obviously, definitely having a picture to see what self-image the patient has, so to know where we want to go is important. But certain changes on the face, you can know. You can see, okay, this structure, I see where it used to be, I see where it is now, so I know that we reposition to this particular position will be a nice effect.
And for somebody that's they think they might need a full facelift, they're not sure, this is something they want to maybe just do first and then a facelift later, is that still possible?
Yeah, repositioning through threads has helped a lot of everybody, including plastic surgeons. Some patients may not be ready for a facelift, but they want to have some improvement that doesn't change their faces. Threads is a great way to go about. Sometimes the patient already had plastic surgery and they need some tweaks and they doesn't want to go back under the knife. So this is a great option. Some patients would say, you know what, I don't need to be perfect. I just want some improvement, but I really cannot afford the downtime of plastic surgery. So I will have some improvement that is meaningful, that I feel is myself, that doesn't change me too much, because I think that that's one of the issues. People don't want to change. They want to see themselves as they used to be.
And you've had tremendous success in Miami, and now you're here in Beverly Hills, and a lot of people do think of Beverly Hills when they think of cosmetic surgery. And what made you want to make this move?
Well, first of all, Beverly Hills is inspirational. Really wants to be better because the clientele is more demanding, so you want to meet those expectations. So as a personal challenge, it's a beautiful situation. Second, for my clientele, celebrity clientele, one of the secrets is that celebrities cannot afford downtime, change too much, too fast, or have adverse reactions. So how do you solve that puzzle? Well, the way to do that is by making very small changes, small procedures, but consistently, so you redistribute the risk and the downtime. And for that, I had to be in Beverly Hills. It was hard to do it through Miami. You cannot maintain the plan.
I always think of that with continuity. If somebody's working on a show and they can't go and change themselves too drastically, yet they still want the upkeep. So if you're just doing, whether it's injections or filler or lift, how often does somebody need to come back and do the Busso Lift?
The Busso Lift, we estimate the duration is about 1 to 2 years. So ideally, we would repeat the procedure before you lose it. So I know it's going to last at least 1 full year. So if we repeat the procedure before that, we had 2 benefits. Number one, instead of waiting for things to go down and then to go back to the same place, we can lift a little bit more. If we lift a little bit more, it looks a little bit better, but also lasts a little longer. So we gain some duration, and but also improves the outcome. So, and one of the issues that we're trying to emphasize, we want more sustainable corrections, not longer lasting, but sustainable. So things which are so anatomically in congruence with the anatomy that the patient's own anatomy maintains that change, as opposed to be imposing the change. And that gives you a longer lasting effect and at a much safer, in a much safer way.
I mean, a common phrase that I hear a lot is, I just don't want to look pulled. I don't want to look Catwoman, you know, and so is threading a safer way to go?
Right, and you can go gradual. So part of the important part of learning about the patient, understanding the patient, is understanding the change tolerance for that patient. When we do a full Busso Lift, we need to explain patients, you're gonna see a major change. Sometimes your iPhone might not recognize you. That much of a change. So we want to see how patients react. So if they feel that it's too much of a change, you know, imagine everything's droopy, all of a sudden everything goes back to the original place. It is a big difference. So if the patient is not ready, so okay, so we're gonna go gradual, we're gonna do a little at a time. So but understand that we can perform a substantial difference on the face because you let it go for too long.
But that's wonderful versus somebody that goes and does a complete facelift and looks like a completely different person, like a Kenny Rogers, and then they can never go back. So this is a nice option where you can start little by little, and maybe you don't even need as much as you think.
Yeah, I have celebrity patients that lost their career over a bad facelift and never could be seen again because changed so much that it became a different person. So definitely very sensitive to that. And you know, we do things in a way according to patients' expectations, but also risk tolerance. So everything's gradual, and you know, we are different, so we all have our own ways of dealing with the aging.
And what are you working on now? What's next for you?
Now, I mean, I love the thread field. I think it's like the future. It's like it's in baby stages, and there's so much to do. So I think that on the face we have accomplished quite a few goals, but now we're doing that for the body.
Oh.
So we're lifting belly buttons, we are decreasing saggy arms, we're lifting thighs. So we're developing the technology for that. So really, it's like I can't wait to go back and keep practicing and developing all these new forms.
Well, we can't wait either, and it's just been so great having you here, and now, you know, bi-coastal. So, I mean, it's just wonderful that you can do that in both areas.
And other things, yes, and at least I definitely need to thank the community of Beverly Hills and LA for the warm reception. Everyone has been so kind, has been so beautiful to interact. So we're having such a great experience, and we hope to be such a positive influence in the community and be able to give back to the community.
Well, we're going to be keeping up with you. We're going to be watching you. So thank you so much, Dr. Busso.
Thank you, Heather, for having me. Thank you so much.
And stay with us. We'll be right back with more.